Endometriosis is a disease where tissue, similar to the lining of the uterus, is found outside the uterus where it doesn't belong. Most commonly in the pelvis and in the abdomen, but it can also end up in really unusual places like the chest, the lungs, and the brain. These clusters of tissue are called endometriosis lesions. These lesions have a very high amount of nerve fibres in them. These nerves are missing some of the coating that's normally on them, called myelin. It's a bit like taking the plastic covering off a piece of wire, so the underlying bits of wire are exposed. These fibres are much more sensitive than normal nerves. So normal activities that wouldn't cause pain in healthy people, like bending forward, sitting down, getting up, cause these nerves to fire and do cause pain in women with endometriosis. This pain is often worse during the period, as these lesions respond like the normal lining of the uterus, so they also bleed. This bleeding irritates the surrounding tissues, causing more pain. Over time, this constant cycle of pain can also cause the brain to turn up the pain signals it receives, a bit like turning up the volume on music. So the pain signals that could be quite minor are perceived by the brain to be much, much worse. All of this means that people with endometriosis often have pain in their abdomen and their pelvis on a regular basis. This is not just a bad period. From our research, most people with endometriosis have at least 2 to 3 days of significant pain each week. And that pain is usually much worse when they're menstruating. And the painful symptoms don't just stop there. Over 3/4 of women tend to have pain during or after sexual intercourse, and many have pain either before or while going for a wee or having a bowel motion. And as if that wasn't enough, most women with endometriosis report one or more other symptoms like fatigue, irritable bowel syndrome, migraines, depression and anxiety, and this is just a few of the common ones. It should be no surprise then to learn that there is no area of a person's life that endometriosis does not negatively affect, from friendships to sexual and romantic relationships, to education, work, and finances, with women reporting a quality of life similar to that of breast cancer survivors. Now, all of this would be bad enough, even if the condition was rare. But endometriosis is much more common than we used to believe. Because you need to have a laparoscopy, a surgical procedure where a small camera is inserted into the abdomen, to see the endometriosis and have a definitive diagnosis, this obviously isn't something that's just done for no reason. So we aren't certain exactly how many people have it. But research shows that it's likely to be between 1 in 10 to 1 in 20 women. This means in Australia alone, even very conservative estimates means that it would affect more than 200,000 women. And on average, it takes about 4 to 7 years just to get a diagnosis. The cost burden on women themselves and on society is at least 7 billion Australian dollars per year. And our latest research, soon to be published, suggests that this might be a significant underestimate. So despite having a cost similar to diabetes, endometriosis gets just a fraction of the funding that diabetes does. Now, while there's no cure for endometriosis, symptoms can be managed. Excision surgery, where the surgeon removes the endometriosis lesions, is the most effective treatment at the moment. But unfortunately, even then, some women report pain that reoccurs after a number of years. Other treatments such as contraceptives, pain medications such as endone, and other hormonal treatments can help control the pain for some, but not all women. And unfortunately, the side effects can be hard to tolerate for many. There's some preliminary evidence that there are some non-pharmaceutical treatments that might help manage the symptoms, including yoga, acupuncture, meditation, heat, and dietary changes. But there's no one-size-fits-all solution. So how do you know if you have endometriosis? Well, like we said before, a diagnosis can only be confirmed by having a laparoscopy. But if you are having pain during your period that isn't able to be controlled by pain medication and affects your ability to do things like go to work or university, you need to go and speak to your doctor. Pain which is severe enough to affect your life is not normal. no matter what people might have told you. There's going to be some links to go with this short video clip where you can go and read more about other symptoms that might need checking out. Finally, there is hope. Researchers both in Australia and around the world are working on better understanding endometriosis, what causes it, how we can detect it without needing to do surgery, and what treatments can we use to reduce symptoms and improve women's quality of life.